Welcome to Cost Saver Conversations. I'm Angela, and I ask the practical questions so you can quickly understand what matters. Today, I'm joined by Assad.
Hi, Angela. We are unpacking UK air quality and health costs, DEFRA versus WHO mistakes, hidden bills, and smarter choices today, and tying it back to the wider cost saver ecosystem, including tools like UK Air Quality Health Cost Engine, DEFRA plus WHO, so you can turn insights into action quickly.
Just a heads up before we dive in, we are your synthetic hosts. We are great with numbers, but as AI, we can sometimes be confidently wrong. Think of us as the digital versions of your most knowledgeable, slightly caffeinated friends.
Exactly. Treat this chat as a smart estimate only, not as professional financial guidance. Always check important details with official sources or a qualified expert before making any big decisions.
Assad, we're talking about air quality today, and honestly, it's one of those things I think most of us just don't connect with our wallets, like at all. It feels like a big environmental thing, not a money thing.
Yeah, and that's actually the first big mistake people make, you know? We file it under environment and move on. But it's fundamentally a household budget story. Cleaner air, fewer sick days, fewer prescriptions, lower care costs down the line. And the reverse is equally true.
So, dirtier air is basically just quietly moving money out of your pocket into pharmacies and GP surgeries.
Pretty much, yeah. And the scale is, Public Health England estimated that long-term exposure to particulate matter and nitrogen dioxide contributes to tens of thousands of equivalent deaths per year in the UK. Tens of thousands. And when you add hospital admissions, lost productivity, social care, the economic cost runs into billions annually.
Billions. Wow.
Yeah.
But that's a national figure, right? Does it actually filter down to, like, my household?
It absolutely does. And this is the bit that gets people. The burden isn't evenly spread. A typical urban household in an air quality management area could be quietly absorbing anywhere from $300 to $900 a year in extra health, insurance, and adaptation costs compared to a rural equivalent. And most people never see the invoice. That's kind of the whole problem.
Wait, 300 to 900 pounds just based on where you live?
Just based on where you live, your postcode, your commute, even, and this sounds mad, even the side of the street your bedroom window faces can shift the maths meaningfully.
The side of the street. Okay.
No, genuinely. There's this example, Priya from Walthamstow. She lives 30 meters from a bus corridor. She fitted a HEPA purifier, moved her toddler's bedroom to the rear of the flat, switched to a quieter cycling route, cut her family's estimated annual health cost exposure by roughly 420 pounds. Didn't move house, didn't spend a fortune.
Oh, that's actually really reassuring because my first thought was, well, what am I supposed to do? Move?
Right, exactly. And most people can't just up and move. But there are things you can do, which we'll get to. First, though, I think it's worth explaining why the data is so confusing, because there are basically two rule books.
DEFRA and the WHO.
Yeah, so DEFRA sets the UK's legally binding standards. Currently, they're targeting 10 micrograms per cubic meter of PM2.5 as an annual mean by 2040. But that target is a policy compromise. It's balancing what's achievable against what's affordable. It is not the level at which health harms stop.
Right.
Whereas the WHO, their 2021 guidelines, they recommend 5 micrograms per cubic meter, half, and that's based purely on evidence of health harm, no politics involved. So most UK urban areas sit somewhere between those two numbers, technically legally clean, but still causing measurable damage.
So you could be in a postcode that's meeting UK targets, but still doubling the WHO recommended exposure.
That's exactly where the hidden costs live, yeah. And it's why people misread the data so badly. Can I walk through the common mistakes? Because I think this is where it gets really practical.
Go on.
Okay, so mistake 1, trusting the town-level average. DEFRA publishes background maps at a 1 kilometer by 1 kilometer grid, which is fine for national policy, but honestly sort of hopeless for individual decisions. Pollution near a busy junction can be double the grid average just 100 meters away.
Double within 100 meters?
Yeah, so you might think you live in clean Bristol or clean Leeds, But if you're near a Canyon Street bus stop, the air you're actually breathing is much worse. It's the fallacy of averages. Does that make sense?
It does, yeah. So what should people actually look at instead?
Check the nearest monitoring station, not the grid average. Look up any air quality management area in your borough. Note the road classification within 50 meters of your front door. Even, and this one surprises people, even elevation matters. Ground floor flats get more NO2 than fourth floor ones. And prevailing wind direction, which in the UK is usually southwesterly, that plays a part too.
Hmm, that's a lot of variables. And I suppose, well, we spend what, most of our time indoors. Is ignoring indoor air another mistake?
It's a huge one. Roughly 90% of our time is spent indoors, but almost every public tool only measures outdoor concentrations. And here's the thing. Cooking on gas hobs, wood burners, damp, mold, cleaning sprays, even scented candles, they can push indoor PM 2.5 far above outdoor levels for hours at a time.
Wait, my scented candles? Come on.
I know. But honestly, yeah, a grain postcode with a wood-burning stove indoors can produce worse personal exposure than a red postcode with electric heating and good ventilation. So if you're only looking at DEFRA outdoor data, you might spend money on the wrong thing, upgrading windows when you should be sorting out an extractor fan.
And wood burners. I've heard they're bad, but I sort of assumed the eco ones were, fine.
Yeah, no. Log-burning stoves are one of the largest urban sources of PM 2.5 in the UK. Even DEFRA-approved eco models emit far more particulates than gas central heating. Far more. People don't want to hear that, but it's true.
Oh, that's actually, yeah, that's not great. Okay, so there's a third mistake too, right? The daily alerts?
Right, mistake 3, confusing peak alerts with chronic exposure. Those daily alerts focus on short-term spikes, which matter, especially for asthmatics, older people. But the biggest lifetime cost comes from chronic low-level exposure. A postcode that never triggers a single alert but sits at, say, 12 micrograms per cubic meter PM 2.5 for years, that will still shorten average life expectancy and raise NHS costs.
So people see low on the daily index and think they're fine.
Exactly. But that daily rating is answering a completely different question to what's my annual risk? And confusing the two is how households end up underreacting to what is, a genuinely expensive problem.
I hadn't thought about it like that. So what else are DEFRA's models actually missing? Because it sounds like there's quite a lot.
There is. So the official figures use something called the impact pathway approach, which is solid, but it's deliberately narrow. First big gap, cognitive and mental health impacts. Emerging research links PM 2.5 exposure to dementia risk, depression, reduced childhood cognitive development. These rarely appear in standard cost models because the causal evidence, while strong, is newer than the cardiovascular and respiratory stuff.
So for a family, that could mean what? A child's test scores being nudged down?
Yeah, or a parent's dementia diagnosis arriving a year or two earlier. Real costs, real human costs, but they're just not in the DEFRA total.
Honestly, that's a bit scary.
It is. And then there's lost productivity. The CVI has flagged air pollution as a workforce issue. Missed work, reduced output on high pollution days, higher staff turnover in polluted areas. For households, that translates to higher sickness absence, increased care leave for kids with asthma flare-ups, even higher private health insurance premiums in affected areas.
Oh, so my health insurance could literally cost more because of my postcode's air quality?
It's starting to go that way, yeah. Insurers are slowly factoring local air quality into their risk models. And then there's the adaptation costs. Once you know your air is poor, you start spending to compensate. HEPA purifiers, replacement filters, better windows, MVHR systems. A decent HEPA purifier runs around 250 to 500 pounds up front, plus 60 to 120 a year in filters. That's a real household line item that DEFRA's damage cost per ton figures just don't include.
And property values too, I'm guessing.
Yeah, property and air quality management areas can see slower price growth.
particularly as buyers become better informed. That's a wealth cost that compounds over decades, and it's why savvy buyers are starting to treat air quality as seriously as flood risk, which is kind of where it should be, honestly.
Okay, so I'm sitting here thinking this is all quite overwhelming. What can people actually do? Because it sounds like a massive problem.
I was gonna say, actually, no, this is the good bit, because small, smart choices can make a surprisingly big difference. Some cost money, most don't, and a few will actually save you money. Start at home with the biggest emitters inside your own four walls.
Like what?
Always use the extractor fan when cooking, especially on gas. Seriously consider retiring the wood burner, or at least only using it on cold, still evenings. Switch to fragrance-free cleaning products, unscented candles. Ventilate for 10 minutes twice a day, ideally not during rush hour. Most of this takes under 10 minutes and costs nothing.
Huh, fair enough. And then a purifier for the bedroom if you're near traffic? We put more research into wedding venues than where we actually live, don't we?
Genuinely, yes. But a 5-minute previewing routine makes a huge difference. Compare PM 2.5 and NO2 across your shortlisted postcodes. Look for streets set back at least 50 meters from A roads. Check for planned clean air zones. Ask about the heating system, not just the energy performance certificate rating. And honestly, walk the area at 8 a.m. on a weekday. You'll sense check the traffic reality pretty quickly.
That's really practical. And commuting? You mentioned that earlier.
Yeah, your commute is often your single biggest daily exposure. And this one surprises people. Sitting in a car in traffic isn't protected air. Cabin PM 2.5 concentrations are typically higher than for cyclists on the same route because you're sitting right behind other exhausts with limited air exchange.
Wait, really? So the cyclist is actually better off than the driver?
On the same route, often yes, but even better, cycle or walk on quieter parallel streets. Use recirculate mode in the car during heavy traffic. And this is a small one, but replace your cabin air filters annually. Don't just wait for the MOT.
Oh, I definitely just wait for the MOT.
Most people do. And look, one more thing. If you must drive through a congested area, close windows and switch to recirculate about a minute before the worst stretch. Cabin PM 2.5 can drop by half within a few minutes.
That's a really specific tip. I like that. So, pulling all this together, there are these postcode level calculators people can use, right? How do you actually use one properly?
Yeah, so don't just enter your home postcode and call it done. Enter your real daily mix: home, work, school, gym. Start with where you sleep, because nighttime exposure over decades is what dominates chronic risk. Then compare both DFRA and WHO benchmarks. The gap between those two numbers, that's your hidden cost, the health impact that current UK policy basically tolerates.
And then you said Model 1 change, not try to fix everything at once?
Exactly. Model 1 realistic change, moving 2 streets back from a main road, switching from a wood burner to a heat pump, cycling a quieter route. When you see the annual cost difference as an actual number, the decision becomes concrete instead of, abstract and overwhelming.
That makes sense. And I suppose this isn't a one-and-done thing.
No, revisit it annually. Air quality changes. Clean air zones are expanding, EV uptake is rising, heating systems are modernizing. Several English cities are scheduled to tighten or expand their zones over the next 18 months. A postcode that scored poorly in 2022 might look meaningfully better by 2027.
Okay, so quick recap for everyone. The big takeaway is that the gap between what UK law says is fine and what the WHO says is actually healthy, that's where your hidden costs are piling up. We're talking potentially $300 to $900 a year for urban households. And that's before you count the stuff DEFRA doesn't even model, like cognitive impacts and productivity losses.
Right. And the 3 mistakes to avoid: don't trust the town-level average, don't ignore indoor air, and don't confuse daily alerts with long-term risk. Those are the traps.
And the practical stuff? Use your extractor fan, think twice about that wood burner, check air quality before you rent or buy, and look at your commute route. Small changes, real money.
Yeah, run a postcode calculator with your actual daily postcodes, Model 1 change, revisit it once a year. It's honestly one of the cheapest financial reviews you can do.
No fees, no credit checks, and the payback lasts as long as you keep breathing.
That's a good line to end on. Assad, thank you. This has been genuinely eye-opening.
Thanks, Angela. Happy to help.
Quick side note. This guide connects with other cost-saver blogs, especially NHS versus private therapy costs, therapy wait time mistakes, and wedding cost mistakes, and hidden costs.
Exactly. And reading those together helps you connect the dots across your household budget, not just this one topic in isolation.
And if you want to apply this immediately, jump into tools like UK Air Quality Health Cost Engine, DFRA plus WHO, right after this episode.
Primary sources used here include Urban Street in the UK with visible air pollution haze and DFRA UK Air Information Resource, so you can verify the data yourself and stay evidence-led.
That wraps this cost-saver conversation with Angela and Assad. If this helped, share it with someone who could put these ideas to work this week.
Your next step is simple. Try UK Air Quality Health Cost Engine, DFRA plus WHO, then read NHS versus private therapy costs and use them together to take action today.